Hey, good evening, everyone. We are live again. Happy Tuesday. How we doing, everybody? Just wait for people to log on a little bit. It is Talk About It Tuesday, and we are ready to go. Super excited. Hey, how are you? People waving and saying hi. You guys have to excuse my hat. I worked out earlier today, and I kind of look like the heat miser up under here because my hair's kind of sticking up in the air. And I figured I'd put the hat on. I sweated it out. It's not cool, so I put the hat on. And I'll just wait for people to kind of come on and log on as I see you joining. I'm super excited. Tonight is going to be so good. There's so much information I want to share with everybody tonight. Just talking about menopause and what it is and what it's not. So share it, tell your friends, tell that coworker that's hot all the time that has a fan, tell your girlfriend, your wife, your best friend that's hot flashing with you. Tonight is going to be so good because I have so much information, guys, and it's kind of like what I really like to do is inform women and teach them and see what's so that they are living their best life, their best hormone life or their best menopause life or whatever it is. So like I said, share it as people start to log on. Again, please forgive my hat. So like I said, I worked out a little earlier, and I kind of look like heat miser up under here because my hair is just sticking up, and with the blonde and all that is just a lot. So I'll put the hat on, my Wicked hat, Wicked the play. If you haven't seen it, go see it. It's an amazing musical. You should go see it if you haven't gone to see it. And I'm gonna go ahead and get started in like a minute so that I can still end on time because it's been my hope to end just at about 9:30. Just do like a 30-minute segment each week with everyone. So I appreciate you guys logging on. Thanks last week, whoever logged on. They shared the videos. They commented even after it was over and posted. And these are all posted on my YouTube channel as well, Dr. Lori J. So I am, hey, Jaslyn. Hey, I am going to be posting these over there as well. So, but I try not to really go past the 30-minute timeline because, well, people get bored and stuff like that. We have a soundbite society, so attention spans don't last that long, right? So for my younger ladies who are logging on, this is for your mom. You're not in menopause yet, but your moms are, your aunts are. If they're crazy and hot all the time and hot flashing, you definitely want to tell them to log on, or after you watch it, you want to share it, right? So anyway, it's like 9:04. I'm gonna go ahead and just get to talking. As people log on, they can, like I said, they can catch up or catch the live tomorrow or catch it on my YouTube. Last week we talked about menopause, and I kind of started the conversation about what menopause is and what it's not. And I said that it's when your menstrual has been gone for like a full entire year, right? And basically it has to do with the depletion of hormones in your body. So hormones are, the main ones are estrogen, progesterone, and testosterone, and they're all present in women, and they begin to decline somewhere in your late 30s, and by about your early to mid 50s, they're pretty much gone. And most women will know that because their cycles will get really irregular, or they'll stop altogether, and they just won't be there anymore, right? So, but then I want to talk about how all the symptoms that you can get as a result from menopause. So you can get the mood swings and the vaginal dryness and the like hot flashes, can be really bad, night sweats, inability to focus, inability to concentrate. We see an increase in anxiety and depression in menopause. And I had stated last time that a good bit of my patients who come to see me are already on some kind of antidepressant or anti-anxiety medicine, but really they just have a hormone deficiency, right? So with the hormone deficiency, everyone it wants, obviously you can't just not have the hormones for the rest of your life. Well, you can, but it makes you kind of miserable because you're not sleeping good, you're hot all the time. Some women are just really nasty. That's the good word, right? Nasty. Those ladies who were nice years ago and now they're just rude. Yeah, well, a lot of them are going through menopause and they're struggling with it, and they don't really know how to bring it in and how to calm it down. So everybody wants answers. So and a lot of ladies nowadays, they don't want they want natural, all everything's natural this, natural that, natural remedies for everything. And I get it because a lot of the medicines do have a lot of crazy side effects. So I'm going to talk about some of the natural remedies you can do. There's things like black cohosh that help with the hot flashes. There's St. John's wort that helps with the mood swings and the anxiety. There's evening primrose oil, which also helps with hot flashes and the mood swings and stuff. And they are available at most herbal stores, even probably CVS and Walgreens. They are plant-based. They're like flowers and herbs and things like that. But there's no real exactly how much is going to be effective. And they keep doing studies trying to figure out how much is going to be effective, but there's no exact amount or number. But with the herbal things, what I've found with my patients who've been on them is that they work pretty good for a while, maybe 3 months or so, and you kind of have to take a break. You kind of have to stop taking them because they kind of lose their effectiveness. Give yourself a couple months off, and then you can start back on them again if that's what you want to do. So, and again, they're okay, but they're not probably the most effective thing that you could possibly take. But, you have as I said last week, menopause is a hormone deficiency. So if I had a vitamin deficiency, I would take vitamins. But you want to take herbs for a hormone deficiency instead of taking hormones. Now, before I know everybody thinks hormones cause cancer, and everybody's afraid of hormones, and everyone's like, oh, no, I don't want that. But I'm going to break down some facts tonight about what really is going on when it comes to hormones, what really happened, what it's really about, and why you don't need to necessarily be afraid of hormones, okay? So, as I said, menopause is a hormone deficiency, right? Hormones, you've been getting these hormones your whole life, 20, 30 years or whatever, and then they start to decline very sharply, and your body feels all the effects of the 400 and some functions they did all those years, right? So now you're feeling a little crazy because you don't have what you used to have, okay? So you're trying to figure out how to supplement those hormones. So I'm going to tell you a brief history of hormone therapy and kind of how it came to be, right? So women have been aging since the beginning of time, pretty much. They've been going through menopause since the beginning of time. And somewhere, probably back in the 30s, they said, well, they used to call women crazy, put them into the mental institution, say they had nervous breakdowns a lot during the menopause transition because they just didn't know what else to do with them. But then I don't even know how they decided they would try this. But somebody said, well, pregnant horses make a lot of this estrogen type stuff. Maybe that's what's wrong with the women. And so they started impregnating horses. And the pregnant horses, when they would pee out large amounts of hormone. this had to be a man. Whoever thought this was a bunch of men, I'm sure it is men, because this just sounds crazy. But anyway, they took this horse urine and they like dried it out and they said, we're going to give this to women and this is going to fix their menopause symptoms. And so that's what they started doing, and they called it Premarin, pregnant mare urine, Premarin, right? And they started giving it to women, and they, lo and behold, it kind of worked. Women felt better. They didn't have the hot flash, and they were like, oh, we're on to something, right? And so then back in like the late 90s, they said, oh, this Premarin stuff is fantastic. Now, by this time, women had been on Premarin for like 50 years. Premarin was introduced in like 1942. So by this time, it's been out for like 50 years. And they are promoting it. At one point, I think when I first was in medical school, they said put every woman after a certain age, put her on Premarin and Prempro, put her on it. It's the best thing ever. And they decided to do a study to see if it would how it would affect women across the board postmenopause. So they took all these women and they were giving them this hormone, this pregnant, and in very high doses for a long time. And somewhere, it was a 10-year study, and kind of in the middle, they realized that they were seeing all this breast cancer and they were seeing all these strokes and stuff. And they were like, oh my God, this is bad. But, this is a litigious society. So instead of them saying that Premarin, which was what they were giving when Premarin was bad, they kind of papered it and said hormones are bad. And they made women think that all the hormones that are out there, all the hormones that are available are bad and bad for you. And got a lot of women freaked out, thinking they were going to get cancer and they were all going to die if they took these hormones. So now there's a huge fear in general of hormones and who should take them and who shouldn't. There's a huge fear because a lot of women just feel like, because of how it was propagated in the media, that all hormones are going to give you cancer and have some really bad things happen. However, all hormones are not created equal. And when I'm talking about breast cancer, ladies, say this to you. Breast cancer is not the number one killer of women. In fact, for women, it's like number 7 on the list. The number one killer of women is heart disease and cardiovascular disease. So if your heart's not healthy, you've had a heart attack, high blood pressure, all that spectrum, that's the number one killer of women, not breast cancer. And as far as cancers go, the top cancer that kills women is lung cancer. So it goes from heart disease to lung cancer. So, I mean, we appreciate the Komen Foundation and all the effort they've done to get women thinking about breast cancer and diligent about breast cancer and getting mammograms and all that kind of stuff. But just understand that that's not the top of the list. Although most women are afraid they're going to die from breast cancer, the reality is we should be way more concerned about heart disease as opposed to cancer. And 2, as far as people being afraid that it runs in families, the number one risk of breast cancer, you want to know what it is? The number one risk of getting breast cancer? Getting old, getting older. That's it. That's the number one risk. The risk of breast cancer increases with age. That's it. So if you live to be 80 or 85, there's like a 1 in 30 chance that you'll end up with breast cancer toward the latter part of your life, because the number one risk is just getting older. Not saying that it's not a serious disease and we shouldn't think about it, but a lot of the media has propagated it in such a way that we think that that's really going to be what takes us out, and it's not, and if you had an aunt or even a grandma who was like 75 and had breast cancer or something like that, that is not your typical family history. You need to be worried about getting it at 35 because your grandma was 75. It's not the same. It doesn't work the same. And there are those people who do get cancer pretty early, and that's a different set of scenarios, a different conversation. higher risk of breast cancer just because you're just getting older. So just wanted to share that with you so you won't be so nervous. But anyway, back to what I was talking about. So back to these hormones. So they're giving these women pregnant, mare urine, right? And all of a sudden there's all cancer and everybody's going to get cancer. So now all the women are like freaking out and they're stopping their hormones and they're having hot flashes and they don't know what to do. They're taking St. John's wort and all that other kind of stuff. So I'm just going to explain to you a little bit about what it is and what isn't, because all hormones are not created. So I said last week that we make estrogens and testosterone and progesterone primarily. So in the body, I have props this week. There's 3 kinds of estrogens that your body naturally makes. And that's, can you see that? Estriol, right? Estradiol, and estrone, right? These are, and the body also makes progesterone, okay? These are the 3 kinds of these are the 3 kinds of estrogen and the 1 kind of progesterone that your body makes naturally. What they were giving women was this. Y'all read it? Sodium equilin sulfate and sodium estrone sulfate. And they were saying as these. They don't even look the same. They don't even sound the same, right? They don't even sound the same. This is conjugated pregnant mare sodium equilin estrate, big words with chemical compound groups. And these are like 3 words: estradiol, estrone, estriol. Very, very simple, right? So they lumped them all together and said all these are going to cause a problem and all these are going to cause cancer, when in reality, they're separate entities. These are considered bioidentical or human identical hormones, and usually can be derived from soy and from plant-based. And what that means is that the chemical structure of that hormone is the exact chemical structure that you've been making in your body since you were like 10 years old, right? So what does that mean? So ladies, I know lots of ladies on here, most of us at one point or another have bought a knockoff purse, right? Anybody bought a knockoff purse, a fake, whatever, Louis Vuitton, Gucci, whatever, and you wore it because it was $40 as opposed to $500 or $1,500 or whatever. So you get this bag and it's really cute, right? When you first bring it home, it's super cute. You carry it and it's looking good and it's, hey, and people go, oh, it's actually Louis Vuitton. Okay, girl. No, it's not. It's a fake, but it's okay because it's your fake, right? But if you keep that bag, you wear it a lot, you take it out a lot, you'll notice that after a while, the peeling will start to rub off, or maybe the color will start to fade, or maybe like the stitching will start to get unraveled and stuff like that, because it's not the identical, it's the fake, it's the synthetic, it's the like this. And the synthetic is never as good as the original. It's never as good as the actual bioidentical. But what they did with hormones is they just took all of them and lumped them all together and made everybody think that they were all one and the same. And the reality is they're not. They even did the same with the progesterone. Your body makes progesterone, and what they were testing women in that study was this medroxyprogesterone acetate, not the same situation. So what a lot of people are worried about isn't necessarily a legitimate situation, because they only tested these equine, equilin, acetate substances. They have They were not testing the actual identicals, because in reality, if these, which is what your body's been making since you were 10 years old, cause that much cancer, a lot more of us would really have cancer because our bodies naturally produce it. Okay, so I'm not saying you need to go out and get them. I'm just saying understand what you're talking about and what the language is, so that you can kind of know what you're really dealing with, and know whether or not is something you want to try. So basically, these are the kind of hormones that I prescribe pretty much all the time, and I have for quite a while. These are the bioidentical hormones, or the human identical hormones. And again, it's what your body is or was making naturally in significant quantities up until you started going through the menopause transition. Now, some of these estradiol in particular is available. You could get it via pharmacy, but a lot of these medications are compounded. So let's talk about some of the different ways you can actually do hormones if you choose to go that route. Number one, you can obviously take a pill. There are some, there's actually one progesterone pill, just one. The other pills are progestins, like the medroxyprogesterone, they're progestins, and actually progesterone. There is one commercial formulation that's a progesterone, and there are a couple estradiol preparations that you can get with prescriptions and take those orally as well. Some of the drawbacks to those would be that they just have 1 or 2 doses. They have a 1 milligram or 2 milligram or 3, and that's kind of what you're going to get. If you need a little bit more, a little bit less, it's not as easy to kind of tweak it to your specific needs. The other formulations are things like compounding creams. I don't know if anybody has ever seen the second Sex and the City movie, where she, like, her bag falls open and all these creams and stuff fall out, and she's like rubbing the creams on her legs and stuff. Those are bioidentical hormone compounding creams, and they have to get made at specific pharmacies. Based on the dose that your doctor will write out for you, based on your blood work, based on your lab work. And those creams will either go like on your inner wrist or on your inner thigh. And for a long time, that was kind of what we had, and it was really good. The estradiol, as I mentioned, is also available sometimes in patches. The little patches you kind of stick on your tummy. You wear those 2 or 3 times out of the course of a week. You change them out, and they can also help with some of your symptoms as well, especially the hot flashes, and the dryness, the vaginal dryness and stuff like that. And then you can also do something called pellets, which are small, kind of like the size of a grain of rice, that get inserted underneath the skin, and they last anywhere from 3 to 6 months, depending on the individual. And they can help alleviate a lot of the symptoms of menopause as well. And then they've kind of fallen by the wayside, but there are also injections. I don't know if you guys remember Suzanne Summers from Three's Company. She came out maybe 10 or so, maybe a little more years ago, talking about hormones, and they were keeping her young and all that. And she was actually doing hormone injections of the bioidentical hormones as well, because she was again promoting the whole longevity and staying well longer. Again, basically, I just wanted to dispel some of the myths and the fears about what the hormones cause. Now, of course, every case is specific, and there are some special cases, and you would have to kind of discuss them in a one-on-one kind of a setting, just because, you don't want, everything's not for everybody, but by and large, there are a lot of options out there that you can do for menopause, but you have to go to or look up or search out a provider that's going to be able to give you what it is that you need, and not just slap you with an antidepressant and tell you to kind of go on your way. Some people who have depression and things like that. Those qualities will get worse during menopause, and they still may need something, but a lot of times, a lot of times, it's just that the hormones are out of whack and out of balance. And once we can get them back online and back set up and back balanced, the women do so much better. As far as the risk of other types of cancers, endometrial cancer, again, they were talking about these here, these horse urine drugs that are not human. Well, yeah, they're not human. They're not only they're not human, but they've been put with a lot of other additives and stuff as well. And so they did cause quite a few more problems. As far as I have a patient who has a heart issue, and she you're gonna have to catch the replay, Mel, because I'm almost wrapping up. But anyway, her cardiologist actually recommended that she stay on some hormones because it is so protective to the heart. And again, you have to discuss that individually with your cardiologist if you have one. But he definitely recommended that she stay on because she had some heart issues, and the estradiol is protective. So again, we're just about to wrap up for the evening, but if you want to take away anything, I want you to remember these couple things. Number one, all hormones are not created equal. So I don't want you to be afraid that every hormone is going to be bad, every hormone is going to give you cancer. That's not the case. You really have to just know what it is that you're getting. And two, breast cancer, although a major concern for women, our hearts and our heart health is also of a major concern, and hormones are protective against heart attacks and cardiovascular disease. Another major issue with women is Alzheimer's, and the hormones do help with that as well. So while you can do your St. John's, you can do your herbs and stuff like that. And I'm not saying do one or the other. I really just want you guys to be informed and just kind of know what it is that your options are when it comes to going through menopause and not having to just suffer with the hot flashes and the sweats and the moodiness and all the other stuff like that, because there are definitely options out there. And again, the hormones that they were talking about as far as the ones that are causing cancer were the synthetic hormones, not bioidentical, not human identical. They are a different class of hormones. And not everybody knows about that. Like, bioidentical hormones have been around about over 20 years. They've been around for quite a while. They've gained popularity probably in the last 10 to 15 years. But a lot of doctors don't believe in them or don't want to know about them, or they feel like we're just going to say no. They probably men though, because the men don't care if we sweat and they're miserable. But some of them don't, But a lot of doctors don't know, but there are many different kinds of options out there. I suggest, though, if you do get any kind of hormone replacement therapy, you really try to go to a gynecologist that does that therapy as opposed to your family medicine doctor or anything like that, just because the gynecologist can handle any other issues that could arise, or know exactly what it is that you're going to need. There's a lot of doctors out here doing things to make money, like they're adding things to their practices that weren't necessarily their field of practice and their scope of practice. And I guess, I'm not saying anything wrong with that, but if you're going to talk about, the vagina and the hormones in the uterus, my opinion is that you should see a gynecologist instead of like your family doctor or your internal medicine doctor, because, and none of they're bad doctors, they're probably great. They just do a lot of it. They do a little bit in a lot of different areas, and don't always understand how one thing can set the other thing off. You know what I mean? So anyway, I hope you guys got something out of it. If you missed it, it's going to be on my Facebook page. It's going to be on my YouTube page, Dr. Lori J. Go back, watch the replay, take notes, email me, ask me questions. I'm here for you guys. I'm doing this just because I answer the same questions every day, all day, to all kinds of women, and I understand that women just don't know a lot about what's going on with them, with their bodies and their cells. And I do this. I've been doing this for 20 years now and answering the same questions for 20 years. So hopefully this will just be some way that you feel like you can ask a doctor. That's me, right? And just don't want to get off the line without, of course, remembering to send prayers out to the families that were affected by the helicopter accident on Sunday. Such a sad thing. Obviously, we don't know them personally, but we can always pray for them. But whoever you do know personally that's going through something, I've been hearing so many deaths in the past few weeks, actually. You know them, hug them, be nice to them, and let's just remember to be kind to each other, be nice to each other. Even if you're having a hot flash, be nice, please try to anyway. Just because there's so much crazy in the world, and you just never know what day is going to be the last one, so you got to always try to be nice. All right, guys, it's 9:31. I will be back next Tuesday at 9. We'll talk about it Tuesday. I don't know what I'm going to talk about next week, but I'll figure it out. So you guys have a wonderful week. Thank you so much for tuning in. I appreciate every one of you for tuning in tonight, and I'll see you next week. Bye.